Hey, survivors, I'm Cynthia Schiller. We're going to talk about the difference between CPTSD and also BPD. So, this is a shout out to one of my subscribers who says that she has BPD. She, I believe, is suffering from some narcissistic abuse. And a lot of times, CPTSD can be misdiagnosed as BPD. So, I'm starting to get to know her. Not quite sure if she has the correct diagnosis. I'm not a clinician, I'm certified to teach psychology. But there's a lot of things, um, a lot of similarities, but also some differences. And we'll go over that so we can either understand our person, understand ourselves. A lot of us have gone through CPTSD after dealing with a narcissist. So, CPTSD, complex post traumatic stress disorder, comes from chronic or long term exposure to trauma. It can happen in adulthood, it can happen in childhood. And BPD is a personality disorder. It's one of those cluster Bs along with narcissism. So there can be comorbidities, it can get really confusing. They've said that BPD, borderline personality disorder, might even just be a failed narcissist. So they often present with narcissistic tendencies. CPTSD, though, can develop from prolonged traumatic experience. It's not just a one-time thing. It can be anything from neglect, feeling like you're in a war zone, domestic violence, and even childhood abuse. So people who have BPD are likely to have unstable moods. Their relationships are often poor, and they have a low self-image due to low self-esteem. So as a result, the people that have borderline personality disorder often have a hard time regulating their emotions and their impulses. So what is complex post-traumatic stress disorder? A lot of different types of events and situations might happen to cause somebody to have CPTSD. And like I said, it can happen in childhood, adulthood, a lot of times with the narcissistic relationships. It can be a parent, it can be a love interest. So CPTSD is different than BPD in that somebody who has complex post-traumatic stress disorder causes difficult emotions connected to their person and their situation. It's rooted in their environment, dealing with them on a daily basis, but BPD is within themselves. So with CPTSD, the experiences that you could have are disconnected from your identity. You have a sense of self, but because of what's going on around you, you start to feel like maybe there's something wrong with you. And you might start to feel that you don't deserve love because of all these things that happen to you. You know, you're never going to find anybody. Nobody's going to love you again, feeling that you're not good enough. So the symptoms that you should look out for is having a lot of intense negative feelings about yourself and even of others, feeling constantly on edge, possibly feeling jumpy, having trouble sleeping or concentrating. A lot of times you get brain fog, and we often avoid anything that might even remind us of the traumatic event or our person. It can include going places. I know for me, I didn't like going to the beach because he wanted to postpone the wedding. He took me to the pier, and the beach reminded me of that. So you can get flashbacks or nightmares and re-experiencing the event through our thoughts. And how is it different? CPTSD, like I said, is long-term trauma caused, and BPD can be caused by a combination of the environment and also genetics, is what they're thinking. And CPTSD tends to persist over long term, and borderline personality disorder kind of comes and goes. So, if you're wondering what you have, are your feelings pretty much constant, or are they triggered? Do they just come and go? CPTSD has a lot of shame, guilt, fear. A lot of us feel guilty for the things that we said or did. We should have done it differently. But BPD often includes feelings of emptiness and boredom. So the way it manifests is different. People with BPD feel empty and just bored. So they act on those impulses. If you have CPTSD, it'll lead to avoidance behaviors, avoiding your friends, not getting your work done, not cleaning your house. And BPD often leads to more reckless behavior, whether it's drinking, partying, risky sexual activities. And CPTSD will often be characterized by emotional flashbacks, while dissociative episodes can describe BPD. Now, I was listening to Professor Sam Vaknin, and he was saying, like I said, that BPD could be failed narcissism. Also, he was saying, and I want to do more research on it, about how the borderline, it is often women, and there's like a psychopath portion to it, where if they it's almost where he was talking about DID, dissociative identity disorder, which is multiple personality disorder, that there are different senses of self that can come out, that they're not exactly like different personalities, but he was saying, that they can come out during drinking. They can be quite spiteful and vengeful sometimes, that they can control them though. So even in the court of law, when they're facing trial, that the courts don't see that as a reason to give them leniency or see it as a mitigating circumstance, because they do have control over these alters, as he put it. So what causes CPTSD versus BPD? And the causes are distinct from each other. So CPTSD can be caused by various events, whether it's frequently witnessing abuse or violence, domestic assault, maltreatment or abandonment during their childhood, ongoing domestic violence or abuse. And narcissists can be quite emotionally abusive, so it doesn't always have to be physical. But BPD can be caused by a combination of the environment. They also believe it's handed down genetically. As far as genetics, I'd like to do a little more research on that, because if your parent has a certain mental illness, is it really genetically handed down, or is it the way that they raised you? Now, there are some twin studies. There are some twin studies out there, so there is some credibility to it. But some experts say up to 50% of people, according to some experts, 50% of people that have borderline personality disorder may also have a close relative with this disorder. So that's where they're starting to think that there's a genetic link. But others believe it's the traumatic life experiences, whether it's neglect or abuse during childhood or adulthood, that can trigger BPD. So to put it simply, PTSD, post-traumatic stress disorder, is more frequently put onto us by environmental stressors, where BPD, they're starting to feel, is more genetic. But are you a product of your environment? So BPD often develops during the teenage years or early adulthood. CPTSD can happen when somebody has prolonged trauma exposure, and that can happen over an extended period of time. And it can occur at any age, even in adulthood is where it tends to happen. CPTSD is more common, so it is difficult to know how many people are affected, because CPTSD is often misdiagnosed as BPD. And a lot of times too, with women, our emotions aren't always understood the right way. Can happen to men too, but there are some treatments that are available. So both CPTSD and borderline personality disorder need to have different types of treatment. CPTSD, a lot of times, is treated with psychotherapy, and that can be anything from CBT, which is cognitive behavioral therapy, which is a type of talk therapy. And by doing that, helps you understand the thoughts and feelings that correlate with our behavior. What are the underlying reasons that we do certain things? And this helps people to reduce negative type of thought pattern and negative behaviors. And they do that by shifting and encouraging positive thinking habits. There's something EMDR, eye movement desensitization and reprocessing. And by doing that, it helps you to deal with traumatic memories. And what you do is you do repeated eye movements while thinking of the traumatic event. And it has been shown to be effective in treating CPTSD. I do have some videos on that. Make sure it's a good fit for you. Some people really like it. Some people don't like it. They feel better afterwards. Others don't like it. So I do have a EMDR video. Comment below if you'd like more information on that. BPD, borderline personality disorder. They like to use combinations of medication and psychotherapy. So they have DBT, which that is dialectical behavior therapy. And this is a type of therapy that deals with your cognition, your cognitive behavioral therapy. And this was originally developed to treat BPD. And it is a combination of techniques that deal from Buddhism, Zen Buddhism, and also combines the cognitive behavioral aspect with techniques. MBT, mentalization-based therapy. And this type of psychotherapy is made to help you understand the way that you think about yourself and also about others around you. Transference-focused psychotherapy, TFP. And this type of therapy focuses on the relationship between the therapist and also the patient. And it's a psychoanalysis. And this type of analysis concentrates on how the unconscious mind will affect someone's behavior and the prognosis. It does vary from person to person. Some people will have a full recovery when they go through treatment. Others might struggle. And CPTSD is more chronic. It's more ongoing than BPD. Often CPTSD requires long-term treatment. And it is good to get therapy or at least knowledge and kind of nip it in the bud as quickly as possible, because it can be disabling if it's left untreated, and it can destroy lives. You know, a lot of us have gone through that. We go through that rumination and a lot of pain that hopefully by understanding what we're going through, we figure out ways to rewire our brain to start healing it. And it definitely is a struggle. And I'm here to help you with that. So please comment below. And we're weathering the storm. We are weathering the storm, and it gets better. It's just a part of time that we have to go through. And there's the 5 stages of grief, and I'd like to help you get through that. I'll see you soon. Please like and subscribe, share. This will help somebody that you know, and I'll see you soon. Have a good night.